Welcome to In the House. My name is Mark Shiver, and very excited to have joining me today Representative Donny Lambeth. He is the senior chair for the House Appropriations Committee. He is the chairman of the House Health Committee. So he's involved with a lot of important things that affect us as citizens across the state of North Carolina. He represents District 75, Forsyth County. Representative Lambeth, welcome.
Well, thank you. And I'm certainly glad to be here and be a participant in this brief update on the activities going on in the General Assembly.
I wanted to read something to you.
Okay.
Just hot off the press. CNBC today. North Carolina ranks #1 in the country as the best place to do business. And that's outstanding. And also, they have said that we are the nation's strongest economy. How about that?
Strong. It's exactly good words there.
Now, let me read you this line out of this article from CNBC. North Carolina's solid finances are the cornerstone of the nation's top economy. Now,
very impressive.
I think that I should, if I were wearing a hat, I'd tip it, because as the senior chair of the House Appropriations Committee, you are keenly involved with framing and shaping our state's finances. So that ought to make you feel pretty good, Representative Lambert.
It does. And, quite frankly, we've done a lot of good things. It's been a real team effort between the House and Senate and to some degree with the governor and his support. We have worked very hard for a number of years now to try to move North Carolina to a very good position in the nation. I think we've been able to do that. And it's taken a lot of fiscal discipline. It's taken a commitment to do some of the right things from a business principle standpoint. And I think, fortunately, the cooperation we've had with all the parties involved have shown that North Carolina can do it, and we have. And I think the future of North Carolina as a citizen my whole life is very, very bright. When a lot of states when I go to these national meetings, a lot of these states are really struggling. They're struggling with the economy. They're struggling with their tax rates. They're struggling with businesses leaving their state. And, most of those things, when I go to those meetings, I'm talking about just the opposite. Even though we're struggling with the economy, we've been able to do a lot of very positive things in North Carolina to help our citizens by reducing the tax rate, putting more money in their pocket. I mean, the recent news in the last 6 months in North Carolina of the new businesses that we've been able to track, I mean, those are wow moments in North Carolina history that we're going to look back and say, can you believe what we did in a very short period of time to change the focus from a business standpoint in North Carolina to be one of the premier states in the nation? And it has taken a team effort and a lot of people making that commitment.
Well, CNBC was careful to point out that it was bipartisanship. And I noticed that in the budget that, obviously, as a senior chair of appropriations, there was a lot of bipartisan support. And ultimately, here in the short session, Governor Cooper just signed that budget. So you guys are working together.
We are. And I think that does show by us reaching out to ask the governor's office, his budget staff, what are some of the things that are your priorities? We try to do the same thing within our own chamber when we talk to our Democrat colleagues. What are the things that are a priority to you? And I think the good news is that there are a lot of things we agree on from a business. I call it the business savviness of North Carolina. And, we tend to get more crosswise around social issues. But when you talk about job growth and tax rates and things like controlled spending, I think there's just a lot of commonality among both parties. And I think that's why we've had such a strong vote, as well as the support from the governor these last 2 budget sessions.
Well, I know that over the last decade, and you've been there for the last decade, we have seen, I call it prudent management of our state's finances. And as someone who was involved in the news industry 10 years ago, things weren't so good. And you guys had to really recover and really changed the entire landscape of the how the state's finances were managed from a position of raising taxes and spending money to actually cutting taxes and seeing revenue grow. It's been quite amazing.
Yeah, it has. And it does take discipline. You have to stick to a plan and you have to focus around what's the real priorities. We've reformed Medicaid, which has been traditionally a big budget buster for the state. And we've done a lot of other reforms looking at ways that we can reduce costs in a lot of the agencies. And I think all those things, as well as the tax reductions that we've made, the reinvestment in key areas in the state, has enabled us to do a lot of things that are very positive. And the market, quite frankly, has responded to our changes that we've made.
Now, you said the M word, so I'm going to go.
Yeah.
I'm going to go ahead and ask you, as the chairman of the health committee, you're also intimately involved in the Medicaid process. I wrote an article years ago when I was doing that in another life as a writer, that Medicaid was a gigantic part of North Carolina's budget. Education is number one, but Medicaid is number two as far as large expenditures go. And for a long time, the resistance to expanding Medicaid has been there. All of a sudden, just to me, as a citizen watching these things unfold, the Senate comes out and says, "Oh yeah, let's do that. It's a good idea." Yeah. And I was shocked, frankly. And so
I was too.
I thought, well, maybe this is, I don't know what they're doing. And lo and behold, they came out with a bill, rolled it out, passed it, and there we go. The Senate wants to expand Medicaid. And I know that part of the hesitation in years past has been a concern about whether or not the federal government would live up to its obligation or its promise to pay for these costs of expansion. As you sit over there as the chairman of the House Health Committee and the senior chair of appropriations, knowing that there's money involved with all of this stuff, what are your thoughts?
That's a great question. And, I have worked on Medicaid expansion for a number of years. The Medicaid program per se is very complicated. It's a partnership with the federal folks. They pay the bulk of Medicaid in North Carolina, but we pay a significant share of that. Anything we do, we have to get approval from the feds. And so a lot of people view it as purely an entitlement program. And, the resistance in the past has been expanding another government program and potentially putting the state on the hook for the unknowns, what it might cost 10 years from now or 5 years from now. And when I've talked about it, it's the individuals that I talked about, because I'm totally against the original concept behind the Affordable Care Act. I think there was a lot of flaws in that. So I've tried to change the dialogue to around how do we create a North Carolina solution that is fiscally responsible. Right. And these are individuals that, for the most part, they work, but they can't afford the private plans because private plans have, quite frankly, either raised their deductibles and copays so high, or their premiums have gotten so high. So they're in a gap, and that's usually the people we talk about. They would qualify for the expanded Medicaid because they've fallen in a gap, and a lot of them are working. A lot of them are farmers. They're veterans, and you can describe that group pretty well. There are very few of them that are actually what you might consider as entitlement and living off the government side.
Right.
But again, it's a very complicated. I think in the last 2 years, some things have changed. North Carolina is one of the 12 states that hasn't expanded for good reason. And we've looked at options around how do we create a plan that's a unique plan for North Carolina? How do we focus it more around wellness, which I think is a flaw in our current health insurance system. It pays for episodes of care, but doesn't do a whole lot on the focus on wellness. So I was trying to think about how do we focus these individuals when they come on the plan to be part of a wellness program. Mm-hmm. Get your screenings done. Make sure you go to your doctor. Manage your chronic conditions. Because a lot of us, quite frankly, don't do that until we have an episode and we end up in the emergency room often. Right. So I think the focus around a North Carolina solution, and then when the Senate began to realize this is a huge economic impact in North Carolina. And the federal folks said, we want to get all the other states on the plan. They put forth a pretty significant monetary incentive for North Carolina, which was about 1.5 billion over 2 years.
Wow.
And that money could be spent on health care needs, or it could be spent on other needs in North Carolina. That's pretty significant enticement. That isn't the only reason to do it. But the big thing that I try to do every year that I talked about it was, I'm a fiscal conservative. I do not want the state of North Carolina to be on the hook to pay future costs, because Medicaid is very unpredictable. So I came up with, working with the healthcare organizations and providers, you guys are the ones going to benefit. We need you to pay the state share. And that was part of the Senate plan, is providers who would benefit paying a tax to cover the state share.
Okay.
And they've agreed to do that. And if that formula were to change, we would simply drop the program. That might be easier said than done.
Yeah.
And so I think there's three things that's caused the dialogue, particularly in the Senate, to shift, and even in the House to some degree. The incentive funds, focus around a North Carolina option and plan, and then the state not having to pay the 10% that the feds have said, but having the providers taxed to pay that. And I think those three in combination have got people more comfortable talking about covering the gap of those individuals who need coverage.
Now, that is the best explanation I have heard so far. So thank you very much for that. It makes it very easy to understand. Now, the House didn't bite, so to speak.
Yeah.
But you came up with an alternative plan that said, let's study this issue, come back later and talk about it and see what we can put together. So why didn't the House just bite?
Yeah. Well, let's just think about that. Because of my background in healthcare, and because I was probably the most involved in the House chamber, I had submitted bills for a number of my terms. But I did not do that this past term. And the reason I didn't was I kind of gave up on the idea, because it never would, move in the General Assembly. And then we've had a lot of change in the General Assembly on the House side over the last 2 years. New members come, members retire. And quite frankly, we didn't talk about it in the House until last year when it came up in the budget negotiations with the governor. And the governor says, we got to do Medicaid expansion, as he's been consistent in saying. So that's how that access committee got formed. But quite frankly, we never talked about expansion in the House caucus or on the House floor. There was not a bill submitted that was a reliable bill that could be discussed. I kind of gave up on it. Well, then the Senate comes up and says, well, let's think more about that, because they begin to understand the benefits to North Carolina,
right,
and to the people in North Carolina. And so in my opinion, we've had a learning curve to try to educate our caucus on what's changed, why it is now good for North Carolina, and how do you fit in terms of your vote and support in that. And when Speaker Moore and I talked about it, we weren't ready to jump right in and move forward. We needed a little time. And that's how the concept of let's continue to study it. Let's actually authorize the secretary in North Carolina to go to the feds and negotiate on our behalf. Accept or reject it. I would tell you that if we approved it today, let's just say magically the General Assembly decided we're going to do expansion today, it will take the secretary 6 months to negotiate with the federal people what that's going to look like. So at some point in the future, we will have to make a final decision based on the terms of the agreement.
Right.
So I personally didn't see that we were losing a lot of time. We were being very direct and asking the secretary to negotiate on our behalf and then bring back a plan that we think we could probably bring back in November, December. And so that was our original thought behind why we would delay, because we didn't do a whole lot of talking about it.
Sure.
And then the Senate put some things in there that needed more discussion. Certificate of need is obviously a very volatile issue in North Carolina between providers and others. And so we felt like that those other issues that had nothing to do with expansion needed to have their own vetting and debate rather than bundling all those things into expansion discussion.
Yeah. Well, thank you. You've cleared this up so well and made it easy to understand. I think that I appreciated the House's position of not diving right in, and this is a long session issue, is what Speaker Moore said, and I agree with that.
It is.
Wholeheartedly. Now, you as a member, you've been there 10 years or so, and you're involved with a lot of high-level stuff.
Yeah.
But you still represent the folks of Forsyth County. And in the time that we have left, I want to talk about your district. In the long session, because of some of the federal money that was around and because of some of the revenue increases that were available, a lot of the members were able to do some things for their district. And I think that you were able to do some things that ordinarily you're not able to do. Talk about some of those.
Yeah, I tried. I have a great district. It's been very supportive of mine. I have a great relationship with Kernersville is the biggest municipality in my area. I have a portion of Winston-Salem, but I really focus a lot around Kernersville. Historically, I've had Walkertown and Blues Creek. And I've tried to stay in touch with those. I do make periodic presentations to those councils. And I have a great relationship with the people in my district that I've really enjoyed getting to nurture and develop. So what happens in the budget negotiations is members do ask for a lot of personal things for their district. And these are, you can look at a segment like water and sewer. We were fortunate to have a lot of water and sewer money. And a lot of our small towns across North Carolina are struggling to fund infrastructure upgrades like broadband and water and sewer. And we were able to do a lot of that out of the federal money. And we've continued to do that because these little towns can't do it without some state help. My areas have had a pretty good system for water and sewer. So I didn't have a lot of needs in the water sewer area. They're very reasonably small. But then when I talked to my folks in my district, things like mental health was an issue. Recreation facilities was an issue. Economic development was an issue. Fire departments have struggled in many of our districts because they can't modernize with the emergency equipment and fire trucks that need to be modernized. So I kind of sat down with those folks and I said, let's figure out what we can do. One of the areas I'm really proud of is a $25 million grant to both Forsyth and Mecklenburg counties that would actually set up a crisis center.
Oh, wow.
And if you've ever paid much attention to what's going on in North Carolina around mental health, a lot of those patients who need help show up at our emergency rooms.
Yeah.
And they're not really adequately treating them. And so this concept was based on some other states' activity, was to, over a couple of years, and we used federal money to do this, create some crisis centers where the local, and the reason it was the counties control the ambulance destinations. So to allow the ambulance to take patients that are behavioral health needs, take them to a crisis center where they have better services rather than an emergency room where they're going to sit and many times they're just there guarded by a security guard. So we're in the process of rolling out a plan to better meet the needs of the mental health patients in those districts. My hope is after we get a little bit of experience, we can actually roll this out into some of the bigger urban areas where mental health crisis is really pretty serious in North Carolina. So that was a really big ticket item.
Yeah,
I did
that's
some
awesome.
things in the fire departments. When I reached out to them, they certainly articulated a need for fire and rescue. We were able to do that. And then I'm also proud of being able to support my district with some parkland money. Quite frankly, we're not taking care of ourselves well enough. And I think expanding walking trails and parks that can get kids out and be more active And we were able to provide some money for parks and little league fields, things like that, that keeps people engaged and energized.
Yeah. Well, you say that, and kind of look at myself here in this camera view, and I know I need to take better care of myself. So I need to get out at some of these parks and walk around. As we finish up, Representative Lambeth, I wanted to ask you about, again, you're so busy with stuff that affects the whole state, but there's got to be a passion there to serve individuals in your district. There's got to be, you wouldn't be down there if you didn't care about that.
Yeah. Yeah. And I appreciate you asking that question. You know, I had 40 years of healthcare experience. I was chairman of the school board for 18 years of Forsyth County, and education became my passion because of my own kids and experiences I saw in education. The fact that I had a great mentor with my family leading me down the education path and being supportive. I actually had no thought about coming to the General Assembly. I'll be right up front with you. And then my House member was a representative named Bill McGee. Bill McGee was a wonderful man. He was mayor of Clemens, and he started calling me and saying, "Hey, I'm not going to run next time. Would you be interested?" And I said, "No, I would not." I said, "My plan is to retire and enjoy life a little bit." But then when I got to thinking about it and we talked about it, I thought Medicaid was a mess in North Carolina. Mm-hmm. My passion was education, and I could bring both of those and hopefully use some of my background and knowledge in both those areas. And that literally is where basically I've spent a lot of my time, is both education and in healthcare. And I've just been fortunate to be in a good position. I applaud Speaker Moore anytime I get a chance to give me a little leeway. He allows me to do a lot of things that probably, because of my background, that a lot of members probably don't have. He trusts my judgment. He talks to me frequently about healthcare issues, and he kind of jokes every once in a while and says, "Hey, I need you to know all about healthcare, because I don't really want to know anymore, but then I know today." And so he does. Fortunately, he relies on me. He asks me lots of questions.
That's good.
And I appreciate that. So I've been in a really good position to be a chair of health, and there is so much in health policy that North Carolina still can do. We can do things around telehealth to link in these rural areas. You know, people back home ask me, "Why didn't you just go enjoy a retirement? You know, you could be out somewhere on the beach or in the mountains or whatever with your grandkids." And that's all true. But I love North Carolina, and I see so many positive things that we can still accomplish in the healthcare arena. And I still think the discipline that we are following on the financial side, the future of North Carolina is unbelievable, in my opinion. And you will continue to see these rankings and probably broaden some of those rankings in other areas like recreation and transportation. Yeah. Because we're doing all the right things, and we're following all the key principles that will enable us to continue to be successful. And, you know, I still want to work on telehealth. You know, from your hallway conversations, that scope of practice in healthcare is a big issue.
Yes, it is.
You know, there's a difference between PAs and doctors and nurses, and we need to resolve some of those things.
Yeah.
And I want to continue to focus on those things fortunately, I have no one running against me next time, and I'll be back for 2 more years. And hopefully those are the kinds of things I will continue to focus on. I've never minded working long hours, and that's what I enjoy doing in the General Assembly.
And yet you still have time for that phone call that says, "I can't get my driver's license to people at DMV won't help me." You got to help folks. You got to help folks navigate the bureaucracy sometimes of state government. Representative Lambeth, I want to have another one of these interviews with you in the future, because I'd like to explore your thoughts about telehealth. I'd like to explore your thoughts about the certificate of needs, and a lot of people don't understand that, but it's, as you said, it's huge. So you have an invitation to come back. I've enjoyed this interview immensely. Thank you very much for not only being our guest, but for all that you have done. I want you to go to CNBC.com. I want you to look at that headline, and I want you to say, we're doing the right thing, and you, Chairman Lambeth, are a big part of that.
Well,
So
thank you, Mark.
accept a little bit of praise from me today for all that you have done to help our state to have the best economy in the country.
Well, thank you so much. I look forward to another opportunity to talk a little bit more about health policy and some of the things that we can do to continue to improve access to care and better take care of our citizens.
Okay. Have a good day, sir. Thank you.
Thank you very much.